You have 4 minutes.
Hello, my name is Dr. Shanae Anderson, and I'm a clinical psychologist in private practice here in Thousand Oaks. I'm also a lifelong resident of the Conejo Valley, and my son, as did I, were students in the Conejo Valley School District. I want to start by acknowledging and thanking the board for your compassion to include and support students who feel isolated and alone, those who feel misunderstood and judged. We share that gift of empathy for those who hurt and suffer. We want to help. However, I know in my work as a psychologist that sometimes my compassion can get the best of me and cloud my professional judgment. So I seek out consultation with a professional who can help me see objectively what I may be missing. Likewise, I am concerned that some of the board's attempts at compassion and inclusion have clouded your judgment and are actually causing them harm. And I hope you will consider my professional input tonight to help you see objectively what I believe you're missing. I am familiar with the event that occurred at Maple Elementary, and while I commend the attempts to be compassionate and inclusive for the one student, it has caused harm to many. Children are born without a sense of self and personal identity. Self-concept begins as a small child and develops through early adulthood. Adolescence is the time when identity is explored and begins to solidify. Prior to that time, children do not have the brain architecture and neural connections to understand abstract thinking. So when third graders are presented with an abstract concept of gender fluidity and transgender, they cannot comprehend the grayness of that construct. At that age and until adolescence, they can only think in terms of black and white. They do not possess abstract thinking. They can only use concrete thought. Introducing such complex subjects years before these children can comprehend creates confusion and misunderstandings that cause cognitive, emotional, and psychological issues that are leading them to my office. Years ago, a patient of mine expressed body hatred and her wish to have her breasts removed. We addressed her body dysmorphia that was rooted in extreme family dysfunction and sexual trauma. Today, she would be classified as transgender and placed on a gender reassignment treatment protocol instead of living a healthy and fulfilled married life as a straight woman with children. Another patient of mine struggled for years with severe anorexia to forestall puberty because she thought it would make her fat. When she entered her 20s and puberty finally hit, she convinced a doctor to give her testosterone to decrease her erroneously perceived body fat. She is now, years later, suicidal because the male hormones have turned her body hypermasculine. She regrets her decision and recognizes it was her self-hatred rooted in her mental disorders that led her to make such incredibly poor and irreversible decisions. I am terribly concerned that psychological issues such as body dysmorphia, eating disorders, sexual trauma, and identity confusion are being misunderstood and mislabeled as transgender concerns. Many of these individuals are actually struggling with other psychological issues that are being clouded by an excessive focus on gender. Please understand that I am sympathetic to the position that the board is in, but it is my job as a psychologist and my field's job, not teachers, to address such complicated issues. Thank you for your time.